Well, that's some views there. Let's bring in tax consultant Adrian Huston. Adrian, what is your view on this? Is it fair to say that you think maybe we're overreacting slightly?
100%. It is a complete overreaction. I do worry about the mental health of a lot of people, and I am worried about the mental state that Robin Swann and his advisors are in, given that they are describing us as on this perilous, slippery slope. There's a lot of very interesting statistics in the Department of Health dashboard. Anyone can Google that, Northern Ireland Department of Health dashboard. And they take an average over the last 7 days of the average deaths, because that smooths out weekends. The average daily deaths in Northern Ireland is 0. It's so close to 0 that it is counted as 0. We get the occasional 1. And it has been 0 since the 2nd of July.
But when you listen to the officials at those briefings and when they come on our programmes and they make the case, at the moment, the figures that they are concerned about are the number of new infections and the number of hospital admissions. Now, hospital admissions, we said it on this programme earlier, they were low. They are at 7 currently, but they are rising, and the number of new infections has risen tenfold since the start of July. They have access to more information than you or I do, surely. So shouldn't we be listening to them?
Well, they do their best at putting this information in the public domain, and there are an awful lot of people analysing the statistics that they see. And I mean, obviously, I've been an accountant for over 25 years. My thing is looking at numbers, and you can see that that the numbers are just not there. People are not going into hospital. 7 in all of Northern Ireland does not justify talk of lockdowns. 0 deaths on average since the 2nd of July, just the occasional 1.
Yeah, you're bringing us back to that figure again, but every time we hear from our minister and from the officials, they're saying that what we're seeing now is as a result of us coming out of lockdown. People are starting to become complacent, they say, and letting their guard down because we've been here for a number of months now, and that we are going to see those figures rise if we don't adhere to some restrictions now. That's the point, not the figure of 0 deaths. We're not talking about that.
Yes, but what they're talking about is the number of positive cases they identify. And if we think about it, most people who go for a test, it's because they have symptoms. 98% of the people who go for a test come up negative. So most people do not have this. Those people that do get it are not getting really sick. They're not ending up in hospital. They're not dying. This is not a justification to continue to strangle our Northern Ireland economy. The poor shops, childminders, taxi drivers, publicans, restaurant owners, all these people are suffering terribly because workers aren't going back to work in their offices and factories.
Adrian, give us the number of deaths that you think should trigger localised lockdowns.
Well, let's put it this way. The number of deaths in Northern Ireland peaked, would you believe, back in April at 14. And back in April, we were all told this was the worst thing. This is absolutely appalling. I am not going to be drawn into telling you what's an acceptable number of deaths. What I can tell you is that the effects that this lockdown and these restrictions are currently having on Northern Ireland businesses are absolutely horrendous. As we've heard, the furlough is coming to an end and probably will come to an end, except for maybe businesses forced to close. But unless people get back to work, it will continue to be a real problem. And the people who get made unemployed, who's going to pay for them? The taxpayers. Those folk left with a job are going to have to pay for all this furlough and pay for all the unemployment benefits, etc. So we have to get people back to work.
Why won't you be drawn on a number? You're the one who started off with numbers.
I started off with numbers because I'm talking about facts, things that have happened to date. It would be silly of me, with my mother-in-law in hospital for the last few weeks, to say, here's an acceptable number of deaths.
But isn't that what you're inferring,
if we're at an average of 0 and we peaked at 14 back in April, clearly it would have to get an awful lot worse than 0 for us to justify localised lockdowns.
Okay, I want to bring in the virologist, Dr. Lindsay Broadbent from Queen's University, who often joins us on the programme. Give us your sense of where you think we are at the moment, given what we know the Health Minister wants to recommend to his colleagues tomorrow. Lindsay, do you think we need to be looking at these measures, restrictions, or do you think that the local lockdowns are where we need to be?
I think what we heard from the Chief Medical Officer, Chief Scientific Officer and the Minister yesterday was right on the money. I think they have their messaging right. They're not trying to terrify anyone. They're trying to say, we're on the edge here and we have to be careful. No one wants to go back into lockdown again, but it might be needed if case numbers get too high. And just to respond there to what Adrian was saying about 0 deaths, and let's face it, no deaths are acceptable. But let's look at the case numbers. The cases coming out at the minute are largely in young people that are otherwise healthy. Because for the majority of the past 5-6 months, people that are more vulnerable have been isolating. They have been shielding themselves. And right now, a lot of those people are much more cautious about going out, being around people. They're taking the precautions they need to. And that's one of the key reasons we're not seeing those deaths and we're not seeing those hospital admissions. But if numbers get too high, chances are those more vulnerable people will come into contact with someone that's infected. And that's what we're trying to stop from happening. We want to be proactive. We don't want to be reactionary when there's suddenly a peak in deaths, like Adrian mentioned. We want to prevent those deaths. No one wants to lose a loved one. No one wants to end up on a ventilator for weeks. No one wants that.
Adrian, haven't we gotten to the position where we're at because restrictions were put in place and we are reaping the rewards for that?
Debatable, because if we look at the Sweden experience and Switzerland, we can see things like, at the end of the day, over the lifetime of this virus, say take 6 months, a year, it may be that lockdowns have done us no good. They've just allowed us to protect the NHS in those first couple of weeks till we got the Nightingale hospitals up and running. After that point, lockdowns should have stopped and we should have got back to business because the NHS was able to cope. That was why we were told we were locking down. But
it was about being cautious, though, and I just want to bring Lindsay Broadbent back.
You can't be cautious all the time. You would never walk out your house if you took caution to the extent we're currently taking.
Okay, well, that's your view. Lindsay Broadbent, some people, and maybe you're one of them, will say that, this is an acceptable price to pay.
It's very hard to put what is acceptable on this. There's obviously other factors to consider, people's mental health, the economy, and those are issues that, we need experts to talk about. We need economists and mental health experts to speak on those subjects. But I'm just talking from an infection standpoint. And in order to limit this infection so that we don't see health issues for long term, we don't see deaths increasing, these measures are needed. And quite frankly, I would think that doing these small local lockdowns temporarily to curb any massive increase would actually be better for the economy in the long run than having to go back into a total lockdown at the end of the year.
Okay. Thanks to you both for coming on the programme and giving us your views. Lindsay Broadbent there from Queen's University, virologist, and Adrian Huston, tax accountant. Yeah, all the latest research and information is available on our digital services. If you head to BBC News NI, you can get the very latest information there about how coronavirus is affecting and spreading through Northern Ireland. So BBC News NI, you'll find it on your phone, no bother. A little bit later than planned.